Happy Vlogmas, everybody! And I'm so excited to kick off this December with you today. I want to share with you all the fun things happening here in the Vlogmas season. So every day you are going to receive a video from moi, and there will be a comment winner selected for each video. We are giving away our Natural Health Resources holiday ornament, as well as a lot of items that we're going to be talking about in these videos. The theme for this year's Vlogmas is all about you. Literally each Vlogmas video is inspired by your questions. I'm really excited about giving the gift of wellness to each of you and trying to answer as many of your questions as I can, to which I am grateful. So let's go ahead and kick off our Vlogmas season with today's first question, and it is specifically about holistic dentistry, what my thoughts are about that, as well as inquiries about PRP and PRFM, which if you're not sure what that is, I'm going to detail all about that to you in today's video. So let's get started. Happy Vlogmas! It's so great to have you join me today, specifically to talk about dentistry and natural ways to improve your dental health. As many of you are probably aware, there's a lot of research that links the state of our dental health with our heart health. And with heart disease being the #1 leading cause of disease for men and women, it's really important that we make those connections between healthy heart, healthy mouth. I've had a lot of you ask, how do I keep my mouth healthy? What do I do? And I'm going to be totally frank with you. I am not a fluoride user, and I am deathly afraid of the dentist. I've had some pretty horrific experiences as a young child and young adult with dentists, and I've had 2 sets of braces. I had retainers, and I even had headgear at one point to readjust my jaw. And needless to say, my own dental health has taken a big hit from having all of that metal, all of the reworking and changing and movement of my permanent teeth. And so I'm very, very cognizant and conscious of my dental health. I shared with you here on a community post in mid-October that I actually found a wonderful dentist. She is just a delight. And she also specializes in more rejuvenative dentistry, not necessarily holistic per se, but is more along the lines of what I feel aligned to personally with the state of my mouth. And maybe this will align with what you're specifically looking for to improve your dental health. So let's kind of dig into what PRP and PRFM is. So PRP broken down is literally platelet-rich plasma, and essentially it's your own magic sauce. There is a mild extraction of blood, and then in a dental office or whoever, there's a lot of different doctors and medical providers tapping into PRP, because we know platelets are rejuvenative and they are found in the plasma. So we centrifuge the blood and separate the blood particles from the plasma. Basically, the platelet-rich plasma that is then re-injected actually has rejuvenative properties to bone, tissue, soft tissue, ligaments, and tendons. So when we're talking about the oral cavity, we have our gums and our bones. And the gums act as ligaments and soft tissue that keep our bones in place. So we can have bone decay, we can have bone loss, we can have gum disease, we can have gum deterioration, we can have gum receding, which I have receding gums and have since I think I was 9 when I had my first set of braces, and my gums were like, peace out dudes, we're leaving. And they literally receded. And I have tried and tried all sorts of natural resources. I use super clean charcoal, fluoride-free, aloe vera enhanced, Ayurvedic enhanced toothpaste, and I have yet to get any type of major change in my receding gums. So I'm going to share with you, I'm utilizing PRP to restore and to rejuvenate my gum tissue, partly because as we age, we have the propensity and we're more prone to gum disease and periodontal deterioration, which then deteriorates and disturbs our bone articulation. It affects our jawline as well. So there are dentists that will use PRP. Now, the other thing that you're going to find in the dentistry setting is that PRP can be used if you have an extraction. For instance, I have a wisdom tooth that at some point is going to have to come out. In that type of case, there would be an extraction and the dentist will infuse PRP or a matter that includes the platelet-rich plasma, and it's called PRFM. PRP has actually been around since the 1970s, and doctors and dentists have known about this technology. It's getting a lot more credibility, and there are tons of folks that are biohackers that are using PRP to restore joints and just to give themselves youthfulness. But the reality is that's not just for biohackers, and it shouldn't just be stuck in the 1970s where we've done research, but now we're seeing it starting to hit the market. There are major trends in the world of dental work that are pretty phenomenal, and I'm so excited to share some of the benefits of PRP and using your own body's platelet-dense plasma is that it stimulates the growth of cells and their division. It'll relay messages between your cells. It promotes healing of wounds. It also will break down and use up proteins for healing. It creates new blood vessels and cells. It will build connective tissues, and it attracts special proteins and cells that can form hard tissues like bones to the treatment site. That's phenomenal, and those are just some top line level benefits. Now, PRF or PRFM is platelet rich fibrin, PRF or M matrix. So PRFM or PRF is the next level of using the plasma plus this very, very strong, almost glue-like substance that is injected into, let's say, a periodontal area. Maybe you've got, you know how they do the scaling and they'll go 0, 1, 1, 0, or 2, 4, whatever the numbers are. I think it goes down to like 8 or 9, and it'll tell you the degree of separation of your gum to your bone. If you are in like the 4, 5 or more category, a PFR injection is showing excellent promise in restoring and rejuvenating that tissue. It can actually reverse periodontal disease. I just had a recent procedure.
And out of this, half I will make a membrane and half I will make a to fill it in your socket.
And I have to say, it was so minor. I'm totally scared of needles. Like the idea of a blood draw just freaks me out. Super minor, real quick centrifuge after we did all my like normal like cleaning and all that stuff. Just a few injections and off you go. It also works really well for individuals who have implants. And I actually had several different questions from you viewers. I think I had like 25 comments on that picture I posted. One of the specific questions was about one of you viewers. Your daughter was under the age of 20 and had had an accident and needed to get an implant. Now, implants require sometimes bone grafting, sometimes there's an extraction, and then it's just like 5, 6, 7 month long process depending on your healing. Well, what dentists are finding is that when they use PRP and PRF in the process of either the extraction and or the bone graft and or when they put the metal dental implant into the bone, those injections actually make it more successful, heals it faster, rejuvenates that tissue, utilizes the natural body's capacity to recognize the bone graft as your own, and you'll have less of an autoimmune response. This is pretty spectacular, friends, because the reality is many of us have dental challenges. I mean, I'm not going to say that I've been cavity free my whole life. It has actually not been the case. And if you watch any of my videos, I'll link right there. I talk about how you have to take care of your oral microbiota and that fluoride is really harmful for your thyroid. Well, you don't necessarily need to run out and get fluoride and that's going to solve all your problems. In fact, sometimes that makes more problems. But when I was growing up, my mom threw tons of fluoride at me. I had all sorts of like elective ways of kind of minimizing my cavities. It made things worse. And then we had a dentist who was a complete fraud, who was a dentist, but he was implementing insurance fraud. And he was actually investigated and arrested by the state. He did all sorts of horrifying things to my teeth, like sandpapering in between my teeth. He ruined some of the enamel of my teeth, and not from anything other than him wanting to build more. So that horrifying experience, I don't like going to the dentist. It's seriously like chalkboard, and the dentists are about on par in terms of what I can tolerate. I can't tolerate either. But if you find a good dentist and you find somebody that's into rejuvenative, restorative healing practices using PRP and PRF, you can actually mitigate disease from developing. You can mitigate the extent of the disease. You can reverse it. And more importantly, you can support your jaw, your bones, and in turn, supporting your heart health. So I hope this was helpful. Comment down below. Let me know if you are interested, or even if you think you're a candidate for PRP or PRF. Comment down below. I'm going to choose one lucky winner to receive our Natural Health Resources ornament. And I'm also giving away one of the David's toothpaste that I love to use from our friends over at Aaliyah. I'll include some links down below where you can grab that if you want to get those immediately. And if you want more videos like this where I talk about natural dental healing, let me know. I have all sorts of things that I use and have implemented to restore softer bones or a lack of mineralization from braces. So while braces gave me wonderfully straight teeth, unfortunately they gave me some byproducts like weakened enamel and mineralization that I've had to take care of. So I'd be happy to share that with you as well. So happy Vlogmas. Comment down below. Please share this video. I'd love to have as many of our friends and your friends receive impactful information from these videos. So hit the share button, post to your social sites, and comment down below. I'll see you on tomorrow's Vlogmas video.